Welcome back, everyone. Hope you had a great break, a great lunch, enjoyed the venue, enjoyed the working. There's something I want to say before we get started with this panel. I have to say this. I'm extremely happy, and I've shared with some of you my feeling today. You know, I feel like, you know the kids when they go to Disneyland and they see the parade, and wherever they look, they see their favorite characters. Well, that's how I feel today. Wherever I look to the right, I look to the left, and I have all the friends and the best characters we could imagine in our ecosystem. So thanks for helping us feel this, and I hope that you're feeling the same way too. Having said that, this next conversation is going to be with Dr. Peter Schulam and Dr. Arnold Rosario from Yale New Haven Health System. And the conversation is about something that we think is very important, which is how academic institutions can help accelerate the adoption of innovation. And we think that this is very important because this includes very much in the very heart of it the point of view of clinicians, which is something that we tend to forget. We tend to talk among us as innovators, and we think that we know how the workflows goes and how the day-to-day is, and the very truth is that we don't. So we just wanted to have here the real experts, the real people who are in these day-to-days, but at the same time, they also push to accelerate this adoption of innovation. So we couldn't have anyone better than Yale New Haven Health System and Dr. Schulam and Dr. Rosario. Just a quick presentation of the institution and the two gentlemen here with me today. So Yale New Haven includes 5 hospitals and a physician foundation. They have more than 25,000 employees and 8,200 medical staff. They have more than 129,000 inpatient discharges, 2 million outpatient encounters every year, and generated more than 4.3 billion in revenues in fiscal year 2017. Regarding Dr. Schulam, he's the Chief Innovation and Transformation Officer at Yale New Haven Health System. He also served as in Yale since 2012 as the inaugural chair of the Department of Urology at Yale School of Medicine, and is chief of the Department of Urology at Yale New Haven Hospital. He's also the inaugural faculty director of the Tsai Center for Innovation Thinking at Yale. Regarding Dr. De Rosario, he's the Chief Population Health Officer at Yale New Haven Health System. He's board certified in internal medicine, geriatric medicine, and has over 30 years of experience as a primary care physician. With that, we will start with Dr. Peter Schulam sharing with us, which is his expertise with the team he's leading as Chief Innovation and Transformation Officer, in how to identify, integrate, and accelerate the adoption of innovation at Yale. So,
Joseph, thank you very much.
Dr. Schulam, please.
Just make sure my mic is on. I think you can hear. And may I have the first slide, please? So I first want to start by thanking Joseph and Christian for the invitation to be here. It's an honor truly it's an honor to be part of the inaugural Barcelona Health Hub Symposium. And Luis, thank you. Thank you for your leadership. I think you should all be very proud of what you have here. Obviously, this is a beautiful place, but what I'm most impressed with is the amount of innovation and the community that you have around that. I think this will be a model for many places throughout the world, and I know I'm going to take back a lot of that I'm seeing and learning here back to New Haven and to Yale. What I'd like to do is just go over a few slides just to give you an overview of how we think. So as mentioned, I'm a practicing surgeon. My area of interest is transplantation, so I do laparoscopic kidney donation. I also run the Department of Urology, but I've been interested in innovation ever since I trained at Johns Hopkins. I trained back in 1992 to 1998, and at that time I was amazed when you looked around the hospital, the pictures from the operating room 100 years previous looked exactly like the operating room I was practicing in or learning in 1992, and I didn't understand why there was this gap. And it was one of those few places in the world it seems like time had stopped. And so it was that kind of pushed me to get interested in innovation, in technology. My PhD is in immunology, and everyone says, do you use that anymore? I think I do, but in a much different way. So at Hopkins, I worked very closely with the innovative team and worked with a lot of companies out in California on robotics. And then when I went to UCLA for 12 years, I built a center there to combine engineering, industry, and physicians. And then now at Yale for the last 7 years, we've set up a center for biomedical innovation and technology. But more importantly, we've set up an institute within the hospital, which I'm going to describe a bit to you today. So this is a survey from the New England Journal of Medicine Catalyst in 2017. And it looks at the health sectors most in need of disruptive innovation. And I think all of us are not surprised, but hospitals, health systems, and healthcare IT led the list. This is good news and bad news. Good news because all of us in this room have an opportunity to impact this. The bad news is, why is it on the list? Why isn't healthcare being disrupted? And it seems to be one of those business sectors that is lagging. If you look at the banking industry, you look at the retail industry, all these industries are moving much faster than we are, the telecom industry. So the question is, why is that? And the themes around that have been touched upon so far today. One, understanding your partner's risk tolerance. I think in Christian's group, the session this morning, there's no doubt we are risk averse. So you have to understand, we have two groups that we're trying to bridge here. We have the innovators, and then we have the health systems, physicians, and administrators. And those two worlds, now having kind of put a foot into both of those worlds, are completely different. I think you as innovators, you're used to taking risk, you're used to pivoting, you're used to failure. The health world, completely the opposite. And in fact, one of our challenges, Arnold, myself, Mike Matthews, who's here also from the Yale New Haven Health System IT, is trying to convince the administrators, the physicians, the nurses, the providers that we should do things differently. And it's hard for them to hear that. It's hard for them to see technology coming in, and they're afraid of the competition that it's going to do with their position within the hospital. Next is the relationship with a win-win mindset. I think, I've seen this today in some of the pitch events, and I mentioned this when I was discussing at lunch, is that understanding the domain and the workflow, you may have a great idea. Your idea could have incredible impact. The problem is my question to you is, how is that technology, that process, going to be integrated into the current working flow of the hospital, of the health system? How is the nurse, how is the APP, the nurse practitioners, the physician assistants, how are the physicians going to use your tool? And I can tell you that is one of the greatest failures of a lot of great ideas, is that early on, when you have an idea, a concept, make sure you think about the workflow. Because again, our world is dysfunctional, it's not logical, and people are not willing to change. Even tools that are fantastic in the operating room come to us, and because they function differently or they're activated differently than a previous tool, it will lead to its failure. That's why we think you need to have partners and experts that you relate with. I think Oscar mentioned it this morning. He was a little disappointed in the number of physicians you had in this room. That's key. You need as many physicians as you need innovators because you have to learn each other's language and you have to communicate. The third is to avoid death by pilot. And Christian referenced this. He said maybe we shouldn't use the word pilot. We talked about this yesterday. The key, though, is when you talk about pilots, make sure you have clinical champions. You need people that are going to be dedicated, both on the technical side and the clinical side, to your project. They get up every morning and they think about your project. They think about your pilot. It can't be 20% of somebody. That doesn't work. And we have done that. We've done that. We've made that mistake. We still make that mistake. Set the expectations for the pilot up front and pricing from the start. So to be honest, we're working with Medictor, and we started talking about this yesterday. The idea is everyone think of a pilot as free. Nothing is free in this world. So even if it comes in and there's no dollars from a health system to an innovation company, there's a lot of sweat equity that gets transferred back and forth. But you also have to start to think about the trajectory. You go from a pilot, you then increase that pilot to a greater distribution within the health system, and then you want to scale. How are you going to do that? What's the trajectory? What are the metrics? What are the milestones? And what is the willingness of the pricing that can be generated each one of those steps? That needs to be discussed up front. Otherwise, when you get to that point, when you have to go to the next level, it could fail. So from our mistakes, what have we learned and what are we trying to do? So we set up the New Haven Health Center for Healthcare Innovation. So it's the Center for Healthcare Innovation, CHI. Our vision statement is given established excellence in providing clinical care and leading research. Yale New Haven Health System, so that is 4 hospitals within Southern Connecticut. Yale Medicine, so that is the School of Medicine and the faculty practice plan. And Yale University, which has, as you can imagine, all the various schools within the university, engineering school, law school, school of public health, school of nursing, are a unified lighthouse for creating, identifying, fostering, and scaling healthcare innovations. A culture of innovation and ingenuity is a marquee feature of the enterprise and its identity. So we identified this as our vision. We want this to work. We want to be mission-driven. So we want to focus on value. So what we define as value is that we want to have the highest quality, the greatest safety, the greatest patient experience at the lowest cost. And how do we do that? It's hard. And I want to point out something in the first bullet. It's not only patient experience. What we're learning now is you have to look at physician engagement. So patient experience and provider experience is equally important. We've learned this because of Epic. Epic has been a huge burden on our physicians, and those physicians now are burnt out. And now when you add additional technology, all they do is run. And it's hard for them to say, we're going to help them, because in a way, we failed them so far. Align with strategic goals and objectives. Solve real-world problems. What do we say? What does this mean? It means don't give us a technology and look for a solution. Understand our world. Help us find the defects, and then let's develop together. So it's the pull versus push. Push does not work. You want the clinical pull. And then this is something that I think we're just starting to dabble with, is we want to start leveraging our data assets now with the ability of recording everything. Even in the intensive care unit, being able to record everyone's vital signs, everyone's labs in continuous time, generating huge data lakes, both in the ICU, we have financial data lakes, we have EMR data lakes. How do we bring those together? Not to mention all the genomics and the other omics that exist out there. Start to layer those, interact with those, and use those to drive discovery. I think this is another area that's really, we're just getting to, and it's the tip of the iceberg. What do? We build culture. So what do we do for that? We basically have events, lectures, and hackathons. The idea here is we need to learn about each other's world. So what these culture events do is it brings together the physician and it brings together the innovators, and they work together. They begin to understand each other's world, and then it comes down to money. So we have to have dollars available to invest in both internal and external projects. And then we've taken some of our funds at Yale and invested it in a fund, so we're a limited partner. And the fund that we've selected thus far in these states funds early stage. So now we're learning with that fund of what they're looking at and how they're evaluating. So we want to have meaningful impact on human lives. We want to really bridge and leverage. And this is where we want to use the university. You have Barcelona. It's an unbelievable city with great intellectual power. So the question is, how do you create those bridges to those other areas within the city so that you can leverage and learn from each other? To me, and we've heard this already, multidisciplinary, that's great. To me, the more difference in thought that you have, the higher the likelihood of creativity. And so what we're doing at the university is that I'm trying to identify all these pockets. They may not even think they're related or interested in healthcare or delivery or technology in medicine, but if I can draw them together, they can understand to look at our world. They may bring insight and thought that we haven't thought about before. So to me, that's the key of leveraging that. And as our last slide, so the question is, what are the opportunities for partnership? And so here, thinking about the stages of innovation, an idea or prototype, an early stage or a growth stage. So these are the people that may be participating or have the idea. So internal innovators or university collaborators or a student. What can the health system provide at that stage? Needs assessment, workflow understanding, standard of care, payers and financials. Startup companies, many of you in this room, those that evolved to an early stage, what can a health system provide for you? Voice of the customer, data access, co-development, pilot and feedback. And then finally, for early stage companies or late stage companies, clinical evaluation, scaling and adoption, thought and leadership, vendor relationship. The bottom line is there's a huge opportunity for creativity and success if we can think of ways of bridging the innovative world with the academic healthcare world. Thank you.
Thank you so much, Peter. Very
welcome.
interesting. I like one of the things that you mentioned in your presentation, and I'd like to start with that, is some experiences with some innovators or innovative companies. And we tend to talk about success stories, right? So it would be great if you can share more about one success story, and it would be even greater if you can share something about a failure story, something that didn't work and what you learned from that. I think it's in your slides, but some particular case that you made.
Yeah. So unfortunately, it's easier to tell you about my failures than my successes. And for some reason, you remember failures a lot more than you do the successes. But here's an example of something I learned. So this is kind of cool. I was at a restaurant in Vermont with my nephew getting a burger. And at the end of the meal, the bill came, like it normally does, in a little leather jacket, but it was a bit thicker than normal. And when I opened it, it said, "Would you take a 1-minute survey?" I said, "This is interesting." And it was basically about the quality of the food, how good was your wait staff, the cleanliness of your area. I said, "Wow, this is a great thing. This is a real-time kind of survey." And what I learned later was there was service recovery with this, meaning that your results were immediately sent to the manager. So before you left the restaurant, they could actually do service recovery. I said, it would be great if we had this in the hospital. Fast forward several years, called the company. They were in Austin, Texas. We got them up. They had dabbled in healthcare. So we have them on 9 floors in the hospital currently. But it's not been a great pilot. And the reason it's not been a great pilot is for all the reasons I just mentioned. We didn't have a clinical champion. So we didn't have someone who woke up every day and said, "This is what we're helping you with." We failed to recognize that their device, which was to be used in the retail world on the internet, was completely different when you take the needs of the internet and put it into a hospital. So we didn't have anybody on IT. The firewall was a disaster. So just to get the system running took us almost 6 months. Again, failure of insight, of understanding the two different worlds. They weren't transferable. We didn't talk about a pilot. We didn't talk about scaling that pilot. We didn't talk about transfer of funds, being a vendor at some point, even if you're getting a discounted rate. So what we've learned from that is, number one, sit down early on. What is the trajectory of the pilot? What are the obligations of both sides? Who is the clinical champion? Who's the technical champion? They're still in a hospital, but it's wobbling, and it hasn't really quite taken off. Interestingly, here's the other thing that drives me crazy is that we're trying to improve patient care, patient experience. The floors, so imagine it's on 9 different floors, teams of nurses, their lead physicians. 2 or 3 of the floors have excelled in their patient experience over the last 2 years. Why? Because they adopted the tool, they used the tool. One of the things we failed to realize is the workflow. How do you get this tablet? Simple question. How do you get the tablet to the patient? Who does that? So in the restaurant, it was easy. The server just used it as part of delivering the bill. We had never thought about that, and the floors were different. So every floor had a different challenge, but the floors that adopted the technology had an improvement in patient experience. The floors that did not have all remained static. So we know it works. We just can't get universal adoption. So I use that as an example of something that it makes sense. The technology is great. but the principles are great, but we failed early on to think about what's going to happen when you go from the retail world to the medical world. What's the workflow? How is it going to be adopted on the floors? Who's going to be the champion? So I think that's an example. It's scary, but I think this happens more often than not. And then once you have a successful pilot, the other question becomes, how do you actually scale? And who's the team that's going to help scale? So these are the things that need to be thought out up front.
That's a very painful but nice story about, a path of reality. We call it the path of reality. It's testing things and seeing where are the risks and the mistakes. Another key for success, we know this is adoption. And we tend to think about the adoption from the patients, but we tend to forget the adoption from clinicians, which at the end of the day need to embrace an innovation, they need to really see how that innovation makes a difference in their day-to-day, in terms of quality, in terms of security, in terms of the experience, etc. So I'd like to ask you, Arnold, about some examples or some technologies that you see that can make a better impact in these terms for you as clinician.
Yeah, so I think that, as you mentioned, I'm a primary care doctor. I still practice medicine. The biggest challenge is as there's been a paradigm shift from healthcare delivery from inpatient to outpatient. The outpatient arena is getting pretty populated, but we don't have doctors that can provide the care, and hence the major problem is how do we give the right care at the right time in the right place? Folks are being sent to the emergency room, which is very costly. For skin rashes and sick patients are going to walk-in centers and retail clinics, and we are losing control in the continuum of care. This is a really big problem. One of the difficulties for us is that we don't have a way of guiding our patients. Our front desk staff, when they call the office, are not clinically trained. They use protocols, but they don't follow anything consistently. Patients don't know what to do. They will go to the place that has access, would not be the appropriate place, might get expensive and inappropriate care. So one of the biggest things that got me interested in working with Oscar and Joseph and so on is the fact that if we had a tool that the patient could use, if we had a tool that the front desk could use, if we had a tool that the emergency room could use, I think we would be able to direct the patient to either telehealth when it's appropriate, to a nurse practitioner when it's a lower level of care, to a physician when it requires complex care, to a specialist in circumvent some of the other issues. And I think we would be much more cost effective, and also we would enhance quality and minimize safety problems.
Mm-hmm. Absolutely. That leads me to one example, or makes me think about one example that you shared about some kind of misdiagnosis that happened over the phone to someone.
Right. So I've been very interested in this, and I think one of the fun stuff has been in the last few months is that we've sort of had a collaborative agreement, and Oscar, who I said, why don't you come and spend some days with us? And I think what Peter said, it's not what you think you should do, it's what you think will be of utility to us in a different market. And although, as some of you know, I lived in Spain for a few years, so I'm familiar with Spain, but certainly the world has changed in healthcare. It's regional. It's changed in the time I've been practicing. And I think Oscar was kind enough to come in. The first thing he asked me, what should I wear? And I told him a bow tie. Now, anyway, so he came in and we had him come in to see patients in the office. I actually had him interact with patients alone. He went to a walk-in center. He's talked to our call center staff. I went to a urology office. So I think he had a pretty good sense of what it's like in the community, at the university, and so on. But what prompted my interest in this is that this is a sad case of a 22-year-old son of a friend of mine who had graduated and was out partying on a Saturday night to the wee hours of the morning. And obviously there was a lot of alcohol consumed. And when he got home in the morning, he was having a hard time waking up, and complained to his girlfriend that he just didn't feel well, and I'm having palpitations. And obviously, sleep deprivation and intoxication, which is kind of symptoms of a hangover as well. But she was concerned enough to call the local emergency room and spoke with a nurse and made the statement that, boyfriend was 22 years old and we've been out drinking at night and partying and he's got palpitations. And She very quickly, through some implicit bias, is my assessment, said, he was a young guy, he's drinking, he's sleep deprived. Oh, just have him hydrate, no Red Bull, no coffee, he should be fine. A few hours progressed, and he got worse and was less responsive, so she dialed 911, the emergency line, and the ambulance rushed him to the local hospital. By the time he got there, he was in ventricular fibrillation, and later on it was, and he led to his demise. They could not resuscitate him. This was an example of what I said was that we as human beings very often take some shortcuts, don't get the whole history, don't ask the right questions, and maybe often don't give the right advice. What I'd like to see is that every case follows a short algorithm, gives you some possibilities, directs you, and there should be no implicit bias. We later on found out the nurse who answered the question was in her late 50s and probably had a 22-year-old who didn't behave himself, and so they project some of their own feelings. But if you ask the right questions, irrespective, and follow an algorithm, everybody should do that. The physician should do that, the front desk should do that, the nurses should do that. You will at least get to the point where you can use human input and then direct the care of the patient. Technology is going to be essential for us if we can take some of the front work off and have physicians and nurses do practice at the highest level of their license, but get prepped with technology. You know, you don't go to the airport today and start giving your passport number and your date of birth. You do that the night before. That's why the lines are shorter.
I think that's a very sad but a good example of how technology can help. And I think that it's not about confronting the technology and the algorithms with the human doctors. That's something we've heard a number of times. And then some try to build a debate around that. But I think there's another way to look at it. And then to me, there is no debate. There is confronting human clinicians supported by technology against human clinicians without technology. And then there is no debate. Of course, any clinician in the world with the support of advice and algorithms and technology will be better than that very same doctor without any support. So I think that no one should feel that they're threatened by machines or technology. They should be threatened by other human clinicians that are using the technology and the algorithms and the innovation, because that's what puts them in danger.
Can I comment on that?
Sure,
Yeah,
absolutely.
Joseph, so I think this is key. I think in the near term could be a decade or two, I think what we're going to be doing with technology is augmenting human care. So we're already doing that a bit in pathology. I think in what Arnold spoke of, if we had symptom checkers that were working in parallel with that nurse, there may have been prompts that would have asked for other questions to be asked that would have taken away or minimized that innate bias. If you look at the robotic platform, so we know the biggest robotic platform is Intuitive. It came out in 2000, but it's taken almost a decade before it's really been adopted. And it doesn't replace the surgeon. It augments the surgeon. But what it does is it enables the surgeon to function. So if we think about everyone in this room, regardless of what we think of ourselves, we follow the Gaussian distribution standard with a standard deviation of 1, right? So we all think we're at the 99th percentile, but in reality, we're going to follow this distribution. Well, surgeons follow that distribution too. Everyone thinks their surgeon is the best surgeon. And so what we need to do is have technology narrow that band and shift it to the right. That is what technology can do. It can remove that variability amongst us. And I think that's what we should be looking for. That's what we want to drive towards.
That's very important. Well, I think that if we need to start wrapping up because we have like a couple of minutes to finish here, but if there is a message that I think that is important for everyone who is trying to innovate here, is that we need to start thinking about the problem that we're solving and how that institution, that hospital, that these members of the health insurance company will be operating in the future with the help of our technology, rather than how we push our technology to that institution, then they will figure out what to do with that and how to integrate that in their context. I tend to tell to the people who's trying to innovate that A lot of times they come with an approach that I call I have a solution looking for a problem, right? So I have this tool and I hope that you have a problem that you can fix it with this tool. But I don't really care about your problem. I only care about how good is my tool and how precise it is and how validated it is, etc. But I don't really care if you need this tool to do something or not. I hope that you have a problem that you can solve with this tool. That's, I think, it's the kind of change we have to do in our mindset. That's my point of view. What I'd like to hear your final statement, your takeaway for the audience in the next seconds.
So I think I alluded to that. Is one of the key things I said to Oscar and when you talk. Now, you have a tool. Come and see what our problem is. Interact with the patients. Interact with the doctors. Interact with the call center and the staff. And I think he had an opportunity, and John was there too, to do that. Because I think it's really important to know where the tool has to be tweaked rather than bring it to market and have it fail because you didn't anticipate what was obvious.
Exactly. Peter?
So I would say we need to listen to each other. So the innovator needs to listen to the physician and the healthcare providers, understand their world, their workflow, their problems, what they're doing, boots on the ground. And then the healthcare providers need to listen to the innovators and understand your world of fail fast, pivoting, regulatory responsibilities, business responsibilities, technical responsibilities, and so that we need to create better communication between those two worlds so that we become unified and we can find solutions to these problems.
Who knows? Maybe in the short term we will see new job positions in hospitals and clinics and places which will be someone to translate the language of innovators to the language of clinicians and the other way around. Yeah. And whoever is able to do that in the best way possible, probably they will be the most successful ones.
I agree.
Hopefully. Well, thank you very much to Peter and Arnold for participating in this conversation and for sharing your knowledge. Thank you everyone for being here and keep enjoying the event. Thank you so much.
Thank you very much.
Do you want to take
Do you want please stay here
Peter.
to take a picture? Now we are going to switch to room.
I guess she meant room 1, but she was cut before she had a chance to say it. What better introduction to our topic than the last few sentences that were said on stage in the other room? There are challenges in the hospital, and one of the challenges is that we're asked to do more with less, or at least the finances behind what we need to do in terms of care provision, innovation, are certainly not limitless. And on the other side, there are solution providers, but somehow there is a little bit of a disconnect. And we need to bridge that gap. This is what these last few sentences were about, and our next panel is really here to discuss that exactly. So I'd like to call a few people on the stage to join me. The first person is Miriam Ors, who is the Chief Innovation and Technology Transfer Officer at the Hospital de la Santa Cruz y San Pau. We're going to welcome Julio Mayol, Chief Medical and Information Officer at the Hospital Clínico San Carlos, and Jordi Serrano Pons, CEO of Universal Doctor, and Mireia Rodriguez from BTAC. So please take a seat and we'll get that conversation started. I think it might be important to put these collaboration back into the context of the hospital or the care organization. It was said before, a lot of these technologies arrive prepackaged and startups think that they're ready to be implemented, and really they're not. Every hospital is very different. The context is different. So maybe we can start with you, Miriam, telling us a little bit about what's the context at the Hospital de Santa Cruz y San Pau. And maybe at the same time you can tell us what is your vision or what are your hopes when you think of working with startups? Yes.
Hello? Okay. Thank you. When we talk about startups and we talk about hospital, we are talking, and before talking about that, we are talking about two different worlds, two different entities, organizations that are in a very different speed. Different.
Different time space.
Yeah.
Nearly,
Yeah.
right?
Then we are trying to find the intersection because we need to work together because the hospital has a really need of implementation new technologies, and but it's very difficult for the hospitals because the hospitals are very regulated, are very, obviously the public, I'm talking about the public hospitals. And then the hospital is very difficult to take, to make quickly decisions. On the other hand, the startups is in another speed. They make new technologies, they are quickly make quickly decisions. And then we need to find the opportunities between two organizations to validate, for example, the technologies and how implement the new technologies in the hospitals. From my point of view, this is very difficult if we and we have to make efforts in use other kind of providers, I think, because for the startup it's very difficult to introduce in the hospital. And I don't know.
I will ask
Julio
in a second to no, keep the mic, Miriam, because I wanted to maybe be a little more concrete about what you do at your establishment, Miriam.
Miriam, for you the question.
Sorry.
So you raise a problem. There is a little bit of a disconnect.
Yes.
We live in different time space.
Yeah.
What is it that you do in your organization to close that gap?
Okay. Then, we work a lot during the last years. We are trying to introducing innovations. Okay. We try to contact the medical services with companies. At that moment, it's important that the solutions that the startup provide solve a real problem. That it's the key question in order to find the common point. And for that, we are pushing to work together, and we use all the companies in order to find collaborations, to try to create partnerships, and so on.
Julio, do you want to react?
Miriam has expressed this really well. We have problems in two different cultures. The startups are ready to fail and they want to fail fast if they want to fail, and they are very flexible, and our institutions are very mature. Failure is not well accepted by professionals and patients. So we need to combine both things, And we don't want to do more with less. We want to do better. That's the question. In order to do better, we need to put together two different cultures and two different ways of thinking to define problems very well and then tackle unmet needs. In order to do that, in my case, I functioned as an info mediator. I am just an agent working between the two different cultures in two different worlds because I understand both. And that's what our innovation unit and our Smart Health Center is. We try to find problems because this was started a long time before with MIT and Ambition. I was the co-director. We put together business people, innovators, entrepreneurs, and healthcare professionals. And together, they defined the problem, trying to find the killing experiment, the one thing that they must test and do it as soon as possible. So if you fail, you don't have to spend 2 or 3 years looking for funding to do something that is not of no value for both the innovators or the startups and our institution. So first, we need to find these ecosystems and identify people who are info mediators. And in our case, we are going to start, we are just starting this project, a catalyst project. We put together these different profiles to define very precisely what the problem is and what the unmet needs are.
So you've gathered people from different departments, you're aligning the stakeholders in identifying the priorities or the priority challenges.
And the flow and also the whole cycle of care. Because if you don't define the whole cycle of care, you may find a solution that doesn't fit. When you go to another hospital, to another institution, then you find that your solution is not well accepted. It's not incorporated because people say, no, this is not the way we work, because we have not taken into account the whole cycle of care, just something that is very local. And then we have a big problem.
Miriam, do you have a similar kind of task force within your organization that...
Yes. Yes, I'm from the innovation unit also, as Julio. And our task force is to find all the resources in order to solve the problems that we have in the hospital or in the research, and to find companies in order to collaborate to solve a real problem, because for me that is the key point, no? In order to solve the real problem. And yes, we work in the same way.
All right, maybe you can have a look at the other side of the mirror. Mireia, do you want to take the mic and
Thank you.
And tell us a little bit about your experience,
Yes.
because you've had some implementation within the hospital world.
Yes, we have been working with hospitals for a while, so we have been going through these pathways. And I would like to say, I have been trying to recommend for people who is doing this for the first time, like lessons learned on our side, in our experience. No? Hospitals have a need. This need is not solved in the market, in the real IT market, for example. And the ecosystem of startups is more flexible and it's more, tolerant to errors, more
Agility?
Yes, more agility and capability of going outside the comfort zone. So, as we are ready for that, we get in collaboration with the hospitals, and what we have been learning about our experiences is that we have to write all this, what we are going to do, in a contract. It can be a friendly contract, but it's like about commitments about commitments from the hospital side, like I need the commitment of IT managers to embed the solution in the legacy systems. I need the commitment of the functional team who will be testing this tool and will be embedding in a whole workflow, not only in a system, but in a workflow of work. We both parts, we will write a schedule, like a chronogram, like phases and milestones, and starting date and ending date. This is, for us, is crucial because we have been having many never-ending pilots, never-ending, and it's very harmful for the companies. We don't have fuel for that.
It's expensive, and if it's not
useful,
useful.
and you get burned, and so.
Very, very concretely, like we're saying that a lot of times hospitals are facing solutions that don't have corresponding problems or challenges. So how did you go about finding that need, that pain point that hospitals, now they need your solution?
How do I get to know they need me? I don't know. This is.
How did you get to identify an actual need that was a real need to respond to a challenge?
Yeah, you have to be very engaged with the community, with, for example, associations of brainstorming meetings with the hospitals. For example, I would say Bioinformatics Barcelona is an ecosystem where many people of different places we meet, like managers of the companies, IT people from companies, hospitals, universities, and there we brainstorm and find problems and find solutions, and we go together. This is how we can detect these needs.
Jordi?
Well, it depends, of the type of startup you are. And if even you are a startup, or after a time you evolve into somehow a company that lives within the institution, and tries to help the institution, Because when I started 10 years ago, 12 years ago, so we even don't know if we can call themselves a startup. We are survivors, but the question is, at that time, we had an idea because of a necessity, it was clear, translation, and we implemented it. We had no capacity to answer your question. We had no time or resources to say, how can detect necessities of the hospital? Of course, along the time, these things have evolved, and the more you meet within the hospital, with their necessities, you get alliances, partnerships, then you know,
Advisors maybe too,
yes,
right?
then you know that in a hospital A, they have a chatbot of follow-up after surgery that this hospital B asks you to implement. The reason tells you, hey, let's not reinvent the wheel, let's do that, and like that, many other things. So in that case, but let's be honest, if you are a startup with just an objective to create a tool, and you have pitched an investor has given you the money, then the investor requires you to focus. And by that focusedness, you don't have time to the hospital partnership and so on. So you should find maybe a distributor, or you should find another company. So your client is not the hospital, the client is that big company will buy you the tool because that company is already in business, in normal business with the hospital. In our cases now it's different because we behave in a very strange mode. We are more advisors to hospitals, and that's why we are working in many different hospitals around the world. Here, but also in Tanzania, also in Toulouse. But each place is different, and I believe that right now it's how you leverage what others do quickly, and you explain them, hey, don't do that because they are failing. That startups also can have their role from my point of view, and quicker. Of course, if you don't have the investor here in the neck, from my point of view.
Miriam, you wanted to?
I understand one of our challenge from innovation units that we need to work in innovation. We look for innovation technologies in order to solve our problem. Is to have the partner, the partner that can solve your problem, and this solution obviously has to are inside the strategy of the company, because if not, there is no future. There is no future for nobody. Then for hospital is, for us, for hospital, for research institutes, we have, we have a lot of companies, we have a lot of different partnerships. It depends on the technology. Because here we are talking about digital technologies, but in the hospital we have a lot of kinds of technologies.
Julio, going down the road, I mean, we've already explored a big challenge. That is one of creating solutions that has no problems corresponding. That's a big problem. But once we have a technology that corresponds to an actual need, what are the other pitfalls or roadblocks down the line? In your experience, what have you witnessed?
Well, first, you must have a team in your institution willing to champion the incorporation of the new technology. Otherwise, as a chief medical officer, I may ask for something that is almost impossible to implement. So first, you need champions, internal champions. Secondly, the second big problem, it shouldn't be a problem, but it is law, it's regulation, it's how we, procurement, how we buy things, and how much money do we have for investments, and how this is going to be acquired and paid for. Sometimes we don't understand the business model for the companies. That's difficult then because we don't know how to pay for this. Secondly, the regulation, the law, allows many different models in the collaborations, but I prefer the regular thing. We go to the market, we ask for solutions, and then we come up with a tender, a well-defined tender. That is the regular thing. It is possible to do that. It has been shown here in Catalonia. And I am not a big fan of these innovation collaborations that you end up having a product that is difficult to purchase. So I will go for the regular tender. The problem with that is you have to sit down with many different stakeholders and write the right tenders.
So there is a proper way of doing it.
And it takes long. The problem is it takes long. And when you have a company that has no financial muscle, it's difficult then to survive. You cannot delay this for many months. And that's a risk for companies. And another problem is, okay, how I, especially for digital solutions, how I make sure that this is safe, that there is no problem with data protection, that my DPO is not concerned about where the database is or how the data is handled. And I need to convince many people within my organization if I want to acquire something like this.
I think we've talked a little bit about what we could call pilotitis, the fact of doing one pilot, two pilot, three pilot, and never actually going to implementation. And there is something to be said. I've had a few CIOs and CMIOs tell me that quite often the startups, they find the main entrance to the hospital too complicated, so they find the little side door. They find that one head of department or that one cool clinician who's like, yeah, sure, I'll try it. And then it ends up in a pilot.
Yeah, the problem with that is that if I'm the chief medical officer and a key opinion leader within my institution comes with a solution that I don't want or I don't need, then you have a conflict, a big conflict. So I feel challenged by key opinion leaders within my institution coming with solutions that have not been co-defined, co-designed.
So lesson one is don't try to go by the side door.
I think it's high risk. If the organization is mature enough, it's high risk.
Some polemic because
the tenders are okay for big companies, no? And for some startups here that have been invested, yeah, they can resist. But for any small startup, it's impossible to wait for a tender. I even, as you know very well, big companies sometimes have made the pilot to really define the tender, and they don't even know if they will win the tender, which is very unfair, no, in some aspects. But okay, it's fair to have the tenders. It's necessary for clarity and transparency. But then there are many things. These small companies, both sides, small companies should have like a package, economical package, no, or by the government, by the hospital itself. But let's not forget, clinicians that want to participate as entrepreneurs within the hospital, I think that by law, maximum, they can have a 10% of the final product. That's also a problem, because then you cannot have the engagement of them. Before, your director, we were lucky to talk with your director, no? I cannot offer my clinicians an increase of salary because of the time. What can I offer to them? No? So I think it's important to offer them this flexibility. So the laws should be changed. Doctors should be allowed to have a big percentage of a company following all the laws, all the conflict of interest, all the scientific-based evidence approach. But if you cannot offer them anything on top of that, if they help you, they will have a 10%. What is that? This is also always the European way of not then being innovative. No, I think it's important to link all these things together.
Well, actually, you're talking about the European way. You have a view because you have a lot of activities outside of Europe. Do you see very different approach and better ones?
Well, everywhere, of course, we have wonderful systems here. We cannot, and the problem is that the citizens in the survey say that the system is very good, and that's why politicians don't change it. That's a problem. But well, the surveys say that 80% of population are happy with the system, no? So I don't know if doctors know, no? Or healthcare workers know. The question is, around the world, yeah, there are many places where they had nothing, and with e-health or digital health have done big steps, no? Kenya, Tanzania, Rwanda. And it's not a democracy, but well, it's a system where everything is the digital health. If you want to make a master or quick PhD, go to Rwanda, and you will see how things work pretty well. And it's wow. So yeah, in places, but of course, in these places, some places it's not a democracy. In some places, so it's not the same rules. No, I do believe that we have enough resources to and changing some laws and giving the great
So in order to shorten the time that we need to deal with hospital, we need to change the law? No, that might take even longer, no?
We need to give incentives. Incentives to the clinicians, incentives to the entrepreneurs, and with that regulation that Julio was saying, of course, for the big companies. And you need to, with that, if you would give that, there are many things to do. I mean, it's...
Yes, in our experience, we have been, wouldn't say piloting, but testing our new developments in different hospitals. And the last agreement we did with a hospital was, we provide you the solution, you tell about ergonomy and functionality, not for my hospital, but for any possible hospital. So we develop something that is interesting for others. And then afterwards, we define outcomes, and we reach the outcomes that are sufficient for both parts. And in the end, you will get this testing for free. And in case we go to market, you have a different price because you have been collaborating. So this is the most easy way of doing business with hospitals, in our opinion, because or you go to a tender, or maybe you go to technology transfer if you have IP shared, and this is very harmful for the companies. We cannot, if you lose your autonomy, no, with intellectual property sharing.
Yes, you are right. When we talk about transference or something like that, this kind of innovation from hospital to market is very long, and the risk for the companies is elevated. And from the other hand, it's obvious that we have a very strict regulation about to buy the technology. then it's for that reason that we are very far from the startups because of all the problems. And then it is necessary that the startups goes to offer the technology with another stakeholder in order to arrive to the hospital.
You mean
that's right. That's
a big
yeah.
industry partner, like an
industry
EHR
partner. Yeah.
provider.
Yes.
Piggyback, they go with the big.
In the mic.
Yeah.
That's
They go piggyback. They go
yeah.
with the big guys. So you have different packages, and they go for a small packages. That's the way to. Theoretically, the new law is about that. Theoretically.
They don't always play well, though, do they? I mean, the big legacy systems for the longest time pushed back on collaborations with startups, and then they started opening up their platforms, and now they even work with startups to create like an app store within their own system. But you feel that, you know, for a long time we asked ourselves, were they friends or foes? And I think the answer was clear in the past. Things have changed. You think now it's a good way to get in?
It should be, but it's not that easy because of the business models for big companies. So that makes it very difficult for them to really foster innovation by allowing small companies, startups, and spin-offs to engage in new solutions. Theoretically, it should be like that. That the new regulation should favor that, but I don't see it happen.
Georgie, Mireia, do you, in your experience, are they welcoming of this type of partnerships? The big guns, as we call them?
Well, yeah, years ago we had agreements with some big software companies to embed our software. It worked in some big software companies already implemented software implemented. Yeah, it worked quite well at some point, but I don't think it's the solution for cutting edge technologies. No, with specific software or things that work for that, yeah, that works. But when they have to try all these new companies with machine learning, or all these, we have here IOMED, we have in Madrid Savannah. Look, they had to fight themselves, no, to work with the hospitals, and of course they're having help also by some Accentures, Deloitte, and it can help. But at the end of the day, it's just temporal solutions, no? And I insist, the only way to make it sustainable would be that the system is sustainable within the solutions. And that, for me, a potential solution could be, okay, why don't startups that have a good relationship with physicians, with clinicians, with with the managers of hospitals, why they are not visits to the people in charge of the economy of healthcare? Because if there is, already in 2009 in Hospital del Mar here, it was shown, based evidence, that people with heart failure, just with a call of a nurse, no, could be better at home, no, and not making readmissions, no, in the last year. And you could save thousands of euros. But there was no budget for the tablets, no? There was budget to support the debt, because the debt was in another department, no? So I think that was the problem, because if Hospital del Mar had money, no, to pay that was a problem. So the solutions could be all the people that have a solution. Now with podometers, we can know that the heart failure, people start walking less and less and less, and you know, no? So all these solutions, you go all together to the administration, and you say, hey, you want to be cool, you want to save a lot of money, and let's do that, no? There's a lot of tools with, innovative, many packages, but it's not generalized. I think that we could save a lot of money if everybody would look up, okay, can we go together to talk with the people in charge of the money? Because as always, you need to talk with the Minister of Economy. If not, nothing changed, no, from my point of view. This is.
Julio, would you be happy to go with?
It's difficult to change the budgets. The public budgets are almost impossible to change because they have been designed to avoid change, basically. So it is difficult because this is counterintuitive for them. So you are right. The problem also is that our information systems are not well designed. They are broken. No matter what electronic medical record or information system you have. So the problem here is how we connect all these new digital technologies to really find out whether we are improving health or not. Are we a sick care system or a healthcare system? And we don't know. So many of these solutions are challenges for us because it's a more complex question already. So you bring a solution that makes me wonder, am I going to be able to show that this makes a difference in people's lives? Can I do that? So for managers and for people making decisions, it's really difficult. It's difficult to explain to probably the health minister wants to change something, but the Secretary of the Treasury doesn't want to change anything because this is more costly to begin with. Then down the line, 6 years later, it's going to be better, but I won't be the minister then.
Actually, Julio, I've heard from one CIO at least in Italy that to work with him, the best way was not to try to go through a tender or through the implementation budget, but through the research budget. He had no money to spend on solutions, but he had money to spend on research. And so by saying we are going to take this technology to lead this research together, build this evidence at the same time, that is the way that he's onboarding technologies.
Yeah. What do you say about what is the budget of research budget?
I'm not sure what his exact budget
there
was.
Is no,
In
there,
Israel, no, there was?
Huh?
probably in
It was
another
in
country.
Italy.
Yeah.
Yeah.
Okay, in another country it's possible, but here there is not exist research budget.
Well, then forget what I
Okay,
said.
then all the research, all the people that work in research, all our goal is to obtain funds for to do research, to do innovation. And the mostly that we use is competitive budget, and research people work very, very strong to find funds, and to do innovation also is difficult. Also for innovation that is come from hospital or from research institutes or another kind of center.
Yeah, the only way is to be smart, getting money from the European Commission. From the European Commission, the H 2020, the Horizon. We have to be smart in order to.
Competitive.
Yeah, it's competitive, but you have to be smart. You must have a strategy, probably not as a single institution, but as an ecosystem, in order to guarantee that you will have enough funds to support long-term innovation and this ecosystem for startups. Otherwise, it is really difficult. Italy has a good strategy to get funds. Spain is not doing that bad, but still, we need to have a global strategy in order to get this startup nation thing.
I think we're going to close this discussion, and I want to thank you very much. I learned a lot of things, and I hope you did too. We're going to move on to our show and tell in this room. It's happening at the same time in both rooms, and I want this room to give you guys a round of applause. And then, as usual, we can continue. We're staying for a photo here or down. And as usual, don't be shy. Go talk to these guys. They have a lot of advice and a lot of lessons learned. Well, this is my panel too, so I'll join, right? Thank you. Thank you. It was a pleasure. So we're going to start in a few seconds here, so please take a seat, waiting for the okay from our executive producer over there. Yeah, we're good to go? Good. So in our last session, this is our last show and tell, so we're going to watch a few technologies. And the topic here is health anywhere, anytime. And that should be really a goal. With all of the IoT tools that we have, we can sleep in a bed that calculates, collects data while we sleep. We wake up in the morning, we can go to a connected toilet that will detect small traces of blood in your urine. Then all throughout the day like that, healthcare could be with us the entire time. So this is the topic of this session. And we are going to start with Trip Doctor. Yes. So Jose is the head of international medicine at Hospital Clinic, but he's also the CEO and founder of Trip Doctor, and he defines this platform as a digital health platform designed to travel with the users. So the floor is yours.
Thank you very much. Good afternoon, and let me say first that I'm completely excited about the last talk because we're coming from a public hospital clinic, and we fully agree with what's been said, so I'm happy with the last talk. So the full idea of our project is based on the large increase of international travel worldwide, which is expected to be around 18 billion by 2030. And you know that around 60% of these people will land in tropical destinations, meaning countries in Latin America, Africa, and also Asia, where the risk of acquiring tropical infectious diseases is quite high. So then For those of you who have ever traveled to the tropics, you know how a typical or classical travel clinic works. Let's imagine that all of us are flying now to Thailand, maybe not together, but we can fly. And then some of us will go to the travel clinic, and then some will tell us about travelers' education information. They will provide vaccines, even malaria chemoprophylaxis. They will inform about possible outbreaks in the destination. And we know for data that 10% of us will come back from Thailand with some diseases. Maybe dengue, maybe chikungunya is quite endemic now there, maybe diarrhea, skin lesions. But what's happening during travel? And we don't know. But up to 50% of people during travel will develop symptoms, and this is when it's mostly needed medical care. And this has, as you can see here, health implications, because you are far from health systems, your health systems, cost implications, both individual and also for the insurance, emotional, because people when feel sick and they're far from home, they get really worried, and that's normal, and social, because maybe you're in your honeymoon and you have to interrupt your activities because you feel sick, and we don't want that. And that's why Trip Doctor was created, to improve health of people, to decrease cost, both for the individual and also for the insurance, and to improve the emotional condition of the traveler, for let them just enjoying their travel. And Trip Doctor is an informatic platform that monitors the health of the people during travel, and also providing telemedicine with travel medicine experts when it's needed in the moment of the travel. Okay? So Trip Doctor has two phases. The front end is a smartphone application that is downloaded before the app and set up. And besides many functionalities, it's monitoring your health during travel, and it's also providing telemedicine through a chat where you can send pictures and be in contact with a travel medicine specialist when it's needed. So it's kind of an anxiolytic thing also. And also we have a back-end monitoring system, which is web-based. As you can see, we have a map where we're mapping all our travelers, so we know the itinerary of the travels, and we can see in real time which is the health status for each of the travelers, so we can provide the best telemedicine we can. With the data we record in this platform, we can do analysis, and in the future we will improve travel risk assessment, which is very important for us to understand which are the real risk of travelers during the trip. And also, with the help of our friends doing artificial intelligence, we will be able to define which of the travelers are most at risk of acquiring the most threatening infectious diseases. So that's very important for us. So in the future, we have a lot of data to analyze. So we did that. That's the final slide. We recruited more than 600 participants already. Berta is one of them. She was very happy because she contacted us from the beach in Mozambique. She wanted to do this manta ray diving. And thanks to our advice, she could do it afterwards, so she was very happy, and I want to show her picture. And I'm very happy to say that in a couple of months, so before the end of the year, we're fine-tuning the last version of the app, so we will be ready for commercializing at the end of the year. Thank you very much.
So as usual, we're not taking any Q&A, but you know that you can see our presenters from the show and tell on the show floor. In the corridors, just grab them, they want to talk to you. Our next demo is a solution called Urban Physio. Miguel is the CEO at Urban Physio, and he defines the company as providing personalized physiotherapy services at home.
Okay, thanks, Pascal. My colleague Irma came today with neck pain, and you know the different options you have right now is you go to the public sector, and you know it's impossible mission to receive a physiotherapy service. If you go for the classic way, you get an appointment in maybe 2-3 days, so he will have to wait till Monday. So that's where we have Urban Physio, that we are addressing a real need. This is not a solution looking for a problem. This is a real need today. So far, we have executed more than 40,000 bookings. We have more than 15,000 customers, and we offer our service from Monday to Sunday in Madrid, Barcelona, Asturias, and Valencia with our own team of professionals. So let's see. Hopefully, it's very easy because Irma is suffering a lot. So let's go. We start from the zip code at the very beginning. Then you choose the product. In this case, will be neck and back pain. The length of the service will be 1 hour because we go for personalized treatments only. And as you can see today, this is real-time demo. Today, 3rd of October, you have the first available slot at 15 to 6. We have 2 of our physios available. So you, for example, choose Sarah, and Sarah will be here in an hour. So then you press next, and the very first time you give us your name, your email, your mobile phone. We have already an account to make it faster. The next step is you say that you are the patient or not. In this case, will be Irma. I will give her data. You say where you're going. So Gina helped us securing a meeting room upstairs. Thanks, Gina. Okay. And the very last step would be to just pay the booking by cash, by credit card, or by PayPal, and then you're ready to go. This is the very first one. Once you have done the very first booking, the next ones are really fast because we know all the information, who your physio is, where you live, what you want, and the only thing you need to do is to press this booking button and just choose the date and hour. As you can see, it's impressive how fast can be. Okay, but what is coming next? I mean, this is our excellent offline service. What is coming next is to be able to provide, be able to treat as many patients as possible based on a real-time travel time distance. For example, this is 10-minute distance, for example, from here or here from Probano, where you can assign a booking to a physio in just 10 minutes. So will be to base the whole system in this concept called isochron, travel time. And of course, to be able to provide a similar experience as other delivery sectors, like for example, when you ask for a Cabify, to have that online tracking, and as well is to expand our current offline experience to the online world, because that will be the best way to improve engagement of the customer and improve our sales and be able to provide a better service. So we are happy to discuss later about partnering opportunities with insurance companies, about any question you will have regarding our business model, or even if you want to look for this service at your company. Many thanks for your attention.
Thank you, Miguel. Next, in our show and tell, we have Mark representing Zurich Insurance. Mark is the product owner of Klink by Zurich and Azul by Zurich. It's a virtual assistant that analyzes users' face and provides his age, smoking habits, and body mass index. Please don't suggest me as a guinea pig for your demo.
Vale, ¿y el Ethernet? Si no lo hago desde aquí, ya está. Sí, por internet. No, da igual, hago desde aquí, por desde aquí, ya está.
And while we're fixing a little technical problem, I'd like to remind you that the photo booth is still open. You can still make that fun picture and maybe win a prize.
Ethernet. No, con esta igual, con esta. ¿Eh? Sí, pues no. Okay, there you go. Thank you. So good afternoon, everyone. So I'm up here because more than 50% of deaths are actually caused by bad habits. And so, for example, having a poor diet may account for 20% is the leading risk factor, but smoking 15%, or having a high body mass index 50% more. It is actually an epidemic, but we think it's really preventable. But changing customers' habits is something extremely difficult to do because it's postponing present rewards, such as lying on the sofa watching Netflix for future rewards that can give you, for example, going out running. But what if we could actually bring these incentives back to clients, back to the present? So that's exactly what we want to do at Zurich Life Insurance. So let me introduce you Azul. Azul is an AI assistant that actually provides discounts for your life insurance based on your healthy habits, and it does so by scanning your face. So let's go through the process, and I'll show you that on real time. So we actually wanted to create, usually life insurance buying processes are kind of boring. They ask you 1,000 questions, so we wanted to do this to change this experience. So we're actually putting the client's face on the center of the experience, and as I was telling before, we're actually extracting 3 biometrics from the face. The first one is the biological age, the second one is the smoking habit, and the third one, the body mass index. So and with these 3 biometrics, we're going to be able to provide discounts to clients. So since we're actually analyzing the client's face, we're able to identify if the client, for example, is smiling, or in my case now, if I look like a famous people. I don't know who Ricardo Margalev is, but he's telling me that I look like him. So the first thing, as I was saying, is my biological age. So he's saying that I'm 31 years old, which is actually correct. So, and what he's doing now here on the right-hand side, he's putting the price of my life insurance. And now here, in this place, he's going to give me discounts for my healthy habits. So since actually my real age is a match with my biological age, he's going to give me 10% discount. You can see it in here now. And now he's going for the second biometric, which is my smoking habit. So he's telling me that I don't smoke, which is actually true. So now he's going to give me 5% more discount for my life insurance, and it is going to start to extract the body mass index of my face. This algorithm is something that we had to develop internally. All the others come from the Amazon Recognition API, but we couldn't find any API that could provide us with the body mass index. So now it is actually extracting more than 4,000 parameters from my face, latent variables, and he's going to provide with my body mass index. He's saying that it's normal, and now he wants to check that it is correct. So as I was saying, this is the first step. We actually want to incentivize clients to live healthier lives, and we're doing this on the onboarding process of the life insurance, but what we want to do now is to keep expanding this solution, to actually build an ecosystem of prevention, and to keep incentivizing clients to live healthier lives. So if we want to find the best startups to do so, so this 2019 we want to select 2 startups that will help us build this prevention ecosystem. So if you think it's of your interest, please come and chat with me later. That's it. Thank you.
Ending with a call for collaborations too. What else do you want? Thanks, very impressive. A little bit scary though, but very impressive. All right, next on our stand we have Jordi Serrano, Ponce. I will not introduce him. He's been introduced 3 times already today. And he's going to present Universal Doctor.
Okay, thank you very much. I'm Jordi Serrano. I'm the CEO of Universal Doctor. We have been reinventing ourselves every year, so we cannot call ourselves a company, a startup now, because it's been 10 years ago. But we have moved, and I want to make it now official. We have moved from this translation tool that everybody knows as, into many other things. We have been working, let's go into the app. We have been working, sorry about that, into many projects. Yesterday, we just launched the app of aging of WHO. Tomorrow, we're traveling to Tanzania. We're launching the London School of Tropical Medicine app for healthcare. So we've been working more than 25 apps that tackle global health issues. And what we want to do now is convert, as we have been telling from time ago, convert all these, what we call Legos, no, into a platform together. So from right now onwards, we will be called the Digital Global Health Company, so we will baptize ourselves, no? So in that sense, what we want to do is, as I was explaining to you, we're launching all these tools, the aging tool, chatbots, rehabilitation tools, but basically what we're presenting today, something that we were willing to present time ago, but finally it's here. It's basically a platform that wants to gather all the different Legos. And we are choosing as a third target travel. And we are not even competing with the wonderful tool that Jose and his team, their teams are doing. This is not the end target of our tool. But we are obviously, we are very familiar with the travel issues for the multilingual tool that we have, and so on. And we decided to start with that. But we're going to launch a family of health companions very soon, and we will invite you to just a specific date to do that. But as you can see here, we have all traditional translation tool that, by the way, with still many hospitals using it. You can ask in many languages with the audio, and more than 32 languages right now. But basically, all these things are working. But on top of that, we have now embedded Medictor. What else can I say about Medictor? Okay, this is a symptom checker that has brought all us here together. Barcelona Health House was found because Medictor was looking for a house. But apart from that, there are three big or four symptom checkers in the world. You have Medictor, you have others. But Medictor is clinically validated. It's always on constant transformation. I think it's super important. So we decided to embed it, because we believe our travelers will use this tool everywhere in the world. I don't have to choose even Medictor, but we are happy that people trust us to embed this big transatlantic in our platform. No? We have travel health advice here, which is basically a very dynamic and very nice, in a kind of Instagram show way, because you need to show, share, and be informed. It's not for tropical medicine, it's just for people that have jet lag, people that executive, et cetera, et cetera. And we're going to launch a lot of all these things. We have a chatbot, Dr. Pola, maybe now, it doesn't matter. But Dr. Polo, Marco Polo. So here we have this bot that we are now testing. We have more than 1,000 questions now, but we want to reach 10,000 potential questions and answers, no? Everything, for example, here, let's go quick. No, Fiebre Maria, okay. And you have the question, then you have the answer, and let's hope it works, okay. So you have many potential questions, but basically, we've been launching many bots lately. And finally, Orca. Orca is an amazing tool, a massive tool that really assess applications, and really, we're happy also to embed that. Go to the presentation, and finally, all these potential partners are there. The tool will be also used for Drasanas, Hospital Vallebron, Tropical Medicine Institute. But again, it's just the starting of a family of tools. Last one, our wonderful team. Now we are 16 people. And finally, we're launching in January. We will invite you all this family of tools that gather all these Legos. We'll have the Aging Health Companion and others. We will give you a surprise. Thank you very much. We will wait for you there in January. Thank you.
What a great way to end the day. Thank you, Jordi. Are we ready to switch to the other room? Yes, I have the thumbs up. So I want to thank you for being with us in this room for this last 2 sessions. And now we'll switch to Maria Luisa in room number 2. Thank you very much.
Let's go, guys.
Hi, good afternoon. Thank you, everybody, for being here today. Thank you to the organization and to the panelists. I'm going to do a very brief introduction. Today we have Oscar, Frederic, and Lucas. Oscar is general partner at Stax, part of the GIM group, a French group which specializes in the design of solutions for the healthcare sector. Frederic is co-founder of Doctoralia, now part of Doc Planner Group, largest platform for healthcare search and accessibility. And Lucas, which is the VP of Sales, EMEA at Dakadu, which specializes in measuring your health with a health score that engages you actively. So this panel, I think, is very interesting because they basically come from small companies, startup, which have really scaled up. So I think it's going to be an interesting conversation. I would like to start, I don't know if the audience really knows what a scale-up is, but I think it's good to start with just a definition from the OECD, which says a scale-up is a company with an annual growth in sales and headcounts over 20% during a minimum period of 3 years. That would be one definition. There are many. Last year, we produced in Barcelona a white paper through Barcelona Global, Barcelona Tech City, and Caixa Day One, which was called Scale Up Monitor, to really understand our ecosystem here, how was the ecosystem in terms of scale-ups, what they needed, etc. So we found a few interesting conclusions, and I'm going to kind of enumerate what we found. The needs that we found were kind of talent, international market orientation, universities and scientific parks in sync with talent creation and becoming catalyst, pool of C-level executives, complementary service for the ecosystem, big corporates involvement, and VCs. So understanding a little bit of that under your point of view and your own industry, what are the main drivers for you or your corporation that you consider key to scale up? Whoever wants to take the floor. Lucas, maybe?
Yeah, thank you. I think for me, as you said before, is very key to define what is scaling up and what is growth. I think many startups get confused about scaling and growing. For me, I think, as you said, there's different definitions. For me, scaling is to increase the revenue without spending more money on resources. For me, that's scaling. And for growing is to spend more, having more resources to earn more. So I think there's two different things. And if we talk about scale up, for me, absolute key is, first of all, to get the system ready in the back, make sure that it can get more traffic, it's solid enough. If we talk about growth, I think it's very important that you get, I would always start with the employees, to get employees on board when you grow who have the same enthusiasm and commitment as the founders. And that's not always easy, especially when you grow quickly. We at Decadu, I started 4 years ago, we were 15, 20 people, now we're more than 110. So we're in this phase now to get many more people on board who've joined recently, and to get the real, the communication flows going. So that's also very key. So I think there's many things we can discuss today.
Well, for me, it's interesting the scale. It's a point. For me, scaling is something that really is the great challenge. So you can have a very, let's say, financially healthy startup that you can be comfortable with 50 employees and doing well, and the startup is a good way of life, but you're not really going to the global market or trying to succeed globally. That is so you're not. If your life is it's okay, you can be comfortable for years, and that really doesn't make you. You don't have the real need of scaling, since you see that there is a competition, since you see that in the future things will go bad for you. So for newcomers, in our case, as Dr. Elliot, was very easy, because we were in a moment you had 75 employees, so we knew each other things, which other issues. I mean, we were like a family, and then suddenly we realized that there was an industry, that it was the online appointment services for healthcare. It was a global industry, far away from the American ideal companies like ZocDoc or even many others. And there were people that was trying to get the countries we were operating sooner or later, because that was a massive investment from France in Doctolib, from India in Practo, rising 60, 80 million euros. So then we realized that, okay, we should do something. And in our case, the step from being 75 people to being 1,200 employees, that is the number of employees we have and growing globally. It was merging with another company with more or less the same size. So Doc Planner was a company with less than 300 employees in that moment. So altogether, we had less than 300 employees. And well, we started to, but the good thing, it was that they had a fast access to investment. No? And this is the point, the need of going to strong sources of investment for this, for growing fast, trying to acquire as much business in your industry as possible, with the best resources in a place like Barcelona, because for us, as Doc Planner Group, Warsaw and Barcelona are the main points for one side because of the tradition of the main companies, let's say, but our CEO is Polish and is based in Barcelona. And our R&D and our developers are based in Barcelona mostly. You know? So we have developers and people in Poland, but also here and growing. So we will move from an office here that has been small enough we were looking for 2,500 meters square in Barcelona. That that's a challenge, finding this size of office, because we will need growing still faster. And this is for me the concept of scaling up. So trying to go. You said I really would like to appreciate. I would appreciate having the paper and having a read to that, because sure. I think that's very it's public. That's very interesting. But especially because it's a change of mindset from a lifestyle for the entrepreneur to something much more aggressive that really has all requirements, and not only of money, also of growing the team, also of getting A-class employees and things like that.
Thank you. Okay, to don't repeat many things, many topics, for me scaling means to have more happy users every day, and then become systemic in the system. This is the key, no? And the problem is how to arrive on that point. But for me, real scaling in this world, and more in this era, because we start many years ago some business, but today the business grow more faster than 15 years ago or 20 years ago, because the technology, because the network, because the Internet of Things, and because many topics. No, so the real scaling is for me is to become systemic in the system. And of course, if you become systemic and you have more happy users, you have more revenues, you have more EBITDA, and you have the board very happy. So this is for me the key moments. In our case, for Stacks, 10 years ago, when we sell the company to Techetin Group, we were just also in the moment to have more than 20% of revenue on EBITDA, and was the moment. No? From my point of view, in my experience, was because we became a part of the ecosystem in the moment of the moment, no, that we were in a moment that the primary healthcare system in Spain was growing. So some people have ideas to how to help these people to make primary healthcare more stronger in Spain, and then become a principal actor. And that was, in our case, the success. No? And then if you make money, so you become a big enterprise, and then you're happy. So that's for me.
Good. So I think for what all the panelists are saying, there is this point where, I think everybody agree that somehow you need to get out of your comfort zone that you have and move forward towards the scale up. We have been talking about the key drivers, right? What do you think or have been your main challenges to really deliver this change, right? Or your worst situations or the things that you would like to recommend entrepreneurs to pay attention when you really move out of your comfort zone and move towards this change?
Yeah, I think for me, one of the main challenges is really in the beginning and I think we heard it in some of the panels before today, is the proof of concepts, the pilots that we're doing, that when you're still small, and you need at some point to find a client who is really willing to take the risk. We are active in this life and health insurance industry, who is a risk-averse industry, of course. So you need to find a challenge for us was in the beginning to find a client who is willing to take also some risk to go big into a product and not just do a proof of concept who is bringing you a couple of thousand. It will kill the business, right? So for us, the challenge is to once we overcame that, okay, we have 1 or 2 big clients on it, make it a success, because on that you can build on. So otherwise, there is really the risk that you feel the death of the POC, we call it. So you need this buy-in, and then obviously once you get it, you have to deliver a good solution. I think that's one of our key challenges, and the other one for me is timing. And do you have the right people at your company when you scale? Is the cash flow positive? Is there a need? Is there a demand for your technology to scale? Because I think the biggest challenge or mistake maybe some startups I've seen doing is to do this too early when this has not been in place. So I think these are, for me, two key areas or key challenges.
Well, in our case, in our case, probably the most important challenge it was having changing the culture. No, so we changing the culture of all of us as employees. So we came from a situation where everybody knew each other to another change with people, first of all, coming from Poland, no? Let's say in some way, from the Polish company. So we changing the language is an issue, no? So it's a question. So our language natural in the company was Spanish. Moving to English is not a joke. So it really makes things more difficult. But the most important thing it was having a common culture, building a common culture with all the people coming from abroad, coming from other companies, coming fast. You hire fast and you hire like crazy. So then the people must land in a space where all of they know which are the values that you have and what's good and what's not. And this is for me the problem, no? And it's a problem. It's an issue because you can have great professionals that really don't fit on the expectations with the other people that you have around. So for me this is something that we manage quite well, and I must say. And the other thing, as you said, is hiring fast. That is also a pain because we were used to looking a lot and keeping the space to the right person for this position, maybe half a year for hiring a developer that should be, the people that NASA would get, or people that Google would get. And then we started to hire like crazy to test and to see, to do in some way, and sounds very ugly, but sounds bad, but doing A/B tests with people, that is, okay, let's hire fast and fire fast, no? And this is something that you must learn as a big company to do, is fighting fast, because it's something that can, if you just keep the people because it was around and all that stuff, is something that really can make you go slower. And this is something that your investors, you want to understand, and the rest of the team won't see as something positive.
Thank you. For us, it depends of course, on the moment you are in the company, in the age that the company have, of course. In our case, and speaking about the acquisitions of companies that were in a moment a startup or a small company, the merge process, no, to become a big corporate. This transition is very complicated and probably a key moment, because the culture of the corporates and the culture of the local people are quite different, and then you need to be very careful in that process. Probably this is a good challenging point. Of course, to align the board members' strategies, no, and all the key stakeholders that are now on the tangle, no, on the new tangle. Probably in the case of the acquisitions process or merge process between companies and of course big corporates, probably this is one of the key or the most challenging points. Yeah.
Mm-hmm. Well, for a little bit for what you say, I would say that one of the important things is move fast and break things, as we say in Silicon Valley, right? I mean, it works sometimes, but but I think that's a key element. I know that not all of you, especially Lucas, are based in Barcelona. You have discussed a little bit about the Barcelona ecosystem. How do you see the Barcelona ecosystem to scale up a company? What would be your main points there? What do you like? What you don't like from the ecosystem? Are you maybe, Lucas, planning to open in Barcelona, and why? Just to give a little bit of a...
Yeah. Thank you. I mean, for us, we started in Zurich, in Switzerland, and we've grown now to the US, to Canada, to Australia, Japan, and Canada, and resellers in selected countries. And so far we do not have an office in Spain, but that might happen in the future. I think what was more important for us is to be able to offer a platform which is available to use in different countries. So our platform is today operating in 40 countries in 13 different languages. That means that we do not need to have resources in each country. I think for us that is key in order to scale. Otherwise, it will never stop. But I think that's, for me, is important to have a solution which is customizable for the different markets. You know, our content for our insurance clients that are using our solution in Germany or in Holland or in Japan is the same technology, but it has completely different content in it. So I think for us that is key, so we don't need people in. So that's why I cannot really speak about the Barcelona economy or how it's growing here, so I'll pass this one over.
Well, it's a pity for you, so you're losing because the most important, that it's very attractive, Barcelona, for the startups and for entrepreneurs and for employees too. So we have a cosmopolitan city, luckily. At the end of the day, there is people around, and you go by metro and you hear more English than Spanish even. So I think that's something great. And it's very attractive because of the weather, because of the regulations, and for youngsters, it's absolutely amazing place to come. And I think that makes that if you start a company here, you have this diversity, but not this diversity that you are appealing at in some way, that is having people from different places to work in the same project, because in some way or another, you should put the local taste in every country. So we have been operating in Doctoralia for years from Barcelona for the rest of the world. So from Latin America, from Brazil, from Mexico, for Italy. And we were able to give a good service because we have locals from every country giving the customer service just based here. No? And I think that this is something remarkable. So you can find people around the world willing to come to relocate here. We have talented IT people here, local IT people that are cheaper than in other countries. That's not a bad thing. And we have, because of that, we have a history that you know better than us even about entrepreneurship in Barcelona. So Barcelona is an entrepreneurial hub. So the good thing here for us is that now it will be, because of the Barcelona Health Hub, it will be also a digital health hub in one way or another. So we have only the fact that in 1 year we have in the Barcelona Health Hub Association more than 100 associates as companies and startups means that there is something. No? So that we are able to attract all these talented people willing to change the world in healthcare things. That is not a thing. So I'm sure that we will see in the next year when this event will come back again, we will see foreign companies and foreign entrepreneurs that have chosen Barcelona Health Hub to locate their new projects, and of course Barcelona as a place to start a global company.
Yeah, sure. We have good weather, nice people, and very beautiful city, of course. Barcelona is really brilliant and nice. Nothing more to add. We have a lot of talent. and I think we have a great noise of share. Here you have institutions, public institutions, you have private sector, you have a good and nice ecosystem to make your projects run. In our case, in the case of Stax and the Digiting Group, we merged the Barcelona Health Hub to be in touch with talent people, with key companies, to generate networking, because it's reality. More and more we need to work together to accelerate our business, because we will become more global time to time. So I think it's a good place to be and to share.
Okay. We have been talking about Barcelona. I think there is one point which is extremely important right now everywhere, which is talent. I mean, talent, it's a scarce resource. I mean, we are seeing right now how latest numbers are saying that talent is leaving Silicon Valley. We can discuss the reasons why talent is leaving Silicon Valley. How do you see talent related to Barcelona? Do you think that Barcelona is an ecosystem which has the potential of talent attraction, and more important than that, talent retention? Or how do you compare Barcelona maybe with other ecosystems? Maybe Lucas first, because he's not here.
You come from the...
you know, and I mean, it's not so easy to go to Zurich, right?
I can just quickly talk about talent for us, what it meant in Zurich. You know, when we were at the stage where the company was really picking up, we needed lots of talent and resources, also in our backend, coders, programmers, high quality people. It was very difficult for us to find, because as you may know, in Zurich, where we have our head office, there is the second largest office of Google outside of the US is in Zurich. And you know, the good talent for backend developers and coders were all being sucked in by Google. Obviously, everybody who can and is working in this field prefers probably to work at Google rather than a small company like Dakudu, right? So for us, it remains a challenge to attract this talent. But what we have at least so far, I think, achieved is that whoever has joined Dakudu have also seen the advantages of being a small organization compared to Google, which also has its benefits. And how it is in Barcelona, I don't know. I can assume it's probably similar.
Not really. Luckily, there is. I think that there is a lot of talent, and as you say, is the challenging thing is not hiring. That is, but also just retaining them. But it's about the cultural organization or the culture that the organization has. So if you are able to give the people good perks and make them feel part of the team, and well, we talking about transparency and be transparent into your company, and make the people feel themselves that your project is their project too. I think that makes sense, because all the rest is around. So he was talking about the weather. We can talk about, I mean, if you, the good thing that the developers have that maybe others don't, maybe sales people don't have, is that they most of them want to have a target in their work. So not only coding, they they like to code for something. So there has to be something at the end of that. So they want to have a mission. That is great. So I have been working next to them for years, and I realized that when they understand the idea, the model, that we are helping people to find the doctor as soon as possible and to make the experience of getting of making an appointment as easy as any other as the Amazon buying process or things like that, they see that that's something relevant, and they really love their job, so they don't leave. Even when we merge, we thought that maybe we could have maybe our developers, local developers, doctoral developers, would choose go away to another place, maybe safer for them, because the other companies had also their own developers. No? Doc Planner had their own developers, and it was not like that. So nobody just left because, well, they understood that it was the future. So that sustainability was being together with others. So we were able to communicate that things will be that. And I think that it was very good. Marius, the new CEO, the planner that really kept calm everybody, saying we were not here to change nothing. So and it was true. So we were very similar in our cultural assets and in the things that really are good. And well, it was excellent. So retaining it depends at the end of the day of the credibility you have as a manager or as a boss, keeping the people and make them feel comfortable in their project. If they feel bad, all you will experience that they will disappear. People disappears. It's like if when an organization is sick, people tends to go out of that. And they will go wherever the hell they find. So it's not a question of it's a question of just moving out of the place. If they feel comfortable, instead of the bad times, instead of crisis, instead of everything, people will stay with you. And for me, this is the real asset and the difficult thing to build, not as a start or a scale, but as a company itself.
Yeah. Okay. What Cezidim choose Barcelona as a software factory for the. We have created. There are working there more than 100 persons in Barcelona. So absolutely is a place to be. Is a place to attract the talent. No? On that point, to attract talent, you need a good project, of course. No, you need something to new and something fresh. Of course, this is very attractive. Of course, money and a project and long-term project probably for the person that come to Barcelona to live. No, family, life, and so on. So at the end, why we are doing things because we want to live with all these things. So I think Barcelona complements all these. No, a way of life, a way to make money, and a way to learn and be part of the ecosystem. No?
Yeah, it's very interesting. I don't know if you heard, a couple of days ago, they did an interview to Rafa Nadal, and they asked him, why do you live here, right? And he said, well, if I would live abroad, I would make probably double of the money that I make here, but here I'm double of happiness. I have double of happiness, right? So it's interesting. We have 2 minutes to wrap up. I would have kind of one last question, which is kind of a double question, which would be how do you see, and you answer a little bit, Frederic, about that. How do you see scaling up differently on the life science space compared to other space? And last recommendation from you that you have gone through the process of scaling up your startups to entrepreneurs, young entrepreneurs or new entrepreneurs that are just in this process of moving from their product market fit or their startup to really becoming starting the process of scaling up.
Okay. Well, the recommendation first for the end. The recommendation for the scale up is that take yourself seriously. So it's very important. Trying to move on and trying not to feel comfortable because it's easy trying to look for the money here in Barcelona and with the local operators. No regrets with Alma and that. But there is a world looking for your solution, and if you have you have been successful, so and you have good metrics, good ratings. The scaling is doing the thing that you have done here or wherever globally. And this is about that. So just don't be afraid of that. Just go for it because it's possible. So there is people waiting for you somewhere to use the money. And the other question was about the.
Well, how do you see scaling in life science differently from
the scaling is scaling. So regulations. The point is that once you have the startup, so you have fight all the regulations, you have fight all the the clinical issues, you have fight everything. So you have done the most difficult part of the journey. So now it's just running. Open. Put money, put gasoline, open the well, and go for it. Because the most difficult part it has been done. So you have tested, it works. You earn money. You have a team. Go for it, and that's all.
Well, I'm seeing there she's showing us already the time. So I think just quickly for an advice, my advice would be when you are at this stage to scale up as from senior management team, be ready to give out responsibilities to others and try and be able to let go of part of it and and let it go to other people and trust. Otherwise, it will not work.
Very short, probably continuous improvement and revolution, and be in touch with key players and stakeholders.
Thank you very much, everybody.
Can go on? Okay, so just to wrap up, ¿Quieres hacerlo desde aquí? Okay. Just to wrap up today, I really, excuse me, please, a little silence, please. Just we are ending the events. Thank you very much. I'm used to wrap up some events, just summarizing a little bit what's happened during the day. But today has happened a lot of things, so it is impossible to summarize everything. But instead of that, I would like to thank you so much to all the keynote speakers, panelists, that I think that from them we have learned a lot. Also, the show and tell sessions coming from a lot of innovation that also is required for the future of the digital health and the future of the humanity, because I think that with the aging population, etc., we have to do a lot of things. Second, especially thanks to the people who has come from other countries, especially Nitipal, Dr. Schulman, and Dr. De Rosario. Thank you so much to all the sponsors, exhibitors, partners, media partners, attendees, all of you. The team has been possible to do this, and the special ambassadors that has been also giving the awards. Also, thank you very much to Luisa and to Pascal in the other side of the room. A big applause for them, please. Also was planned to give a last reward here from the more original photo from the booth, but as we have done a lot of pictures, we have to just review and we'll publish who will be the winner of that. So, and the winner will have a free entrance for the next event next year, the Barcelona Health Hub event. Also, next events, just to remind to you, we have 3 important events. One is Investor Day. The second will be 4 years from now. We count with all of you. And for next year, we will have, during the same days as we have celebrated this Barcelona Health Hub Summit, we will have the second summit of Barcelona Health Hub. I'm sure that it will be improve a little bit, things that once we review all the session today, we will think about having new opportunities to share with you next year. Also, I think that, well, the show goes on, so the show is continuing downstairs once we wrap up here with an open bar just to share knowledge, ideas, or just for networking and to share talent with all of you. And finally, we have a surprise that is a video very well recommend for all of us. So thank you very much for joining today. Thank you.
One evening, my father said,